So, hey everyone, this is the Ben and Gary Show, and we love dentistry, and we know dentistry is what we're doing here. And unfortunately, I'm doing it solo today because my partner, Dr. Gary Carhara, is visiting his family out there in LA and enjoying some much needed time, energy, sort of recharge. And he's also going to be also in the at the Spear Center gaining some continuing education on a really interesting topic that I'm sure we're going to talk about at some point in time. But this is called airway dentistry. So that's a really interesting subject here, but that's a whole nother time. Today, we have an interesting topic to discuss because one of our callers, one of our communicators here sent in a question and asked about what type of procedures do periodontists do? And I think that's a terrific question because there's all these different other specialties in dentistry, and most of the time people just know about maybe an orthodontist who just straightens teeth, maybe an oral surgeon if you've had a kid who's gotten their wisdom teeth taken or had to have them removed. But a periodontist, outside of what's just a basic dentist, like what in the world is a periodontist and why do I need one? So maybe in order to understand the type of procedures that a periodontist actually does, we should talk about what is a periodonist. And a periodontist is a specialist in dentistry who's done an additional 3 years after dental school, which is 4 years, so 7 years of post college training to be able to understand how to prevent, how to diagnose, and how to treat periodontal disease. Periodontal disease is a fancy name simply for bone loss around your teeth. So if you're getting long in the tooth, unfortunately, that does mean that time has gone on. You are getting older here, but unfortunately, what it means that the bone around the roots of your teeth that anchor your teeth in your jawbone is actually essentially melting away at a said rate. And if you the unfortunate ultimate the symptom of periodontal disease is tooth loss, and nobody wants to lose any teeth. And certainly nobody wants them to just simply get loose and fall out. So before all that happens, you need to see a periodontist. So, periodontal disease can be treated by your general dentist, and they can certainly do that in a non-surgical way, scaling and root planing, sort of cleaning your teeth, coaching you on how to be able to maintain optimal oral health at home, as well as maybe some antibiotic or oral agents to be able to help you fight that periodontal disease, that inflammation that is occurring in the gum tissue, as well as also inflaming the bone. And therefore, the bone wants to get away from that inflammation that's in and around your gum tissue. So hence, you have bone loss in that process. And in fact, actually, I would probably most associate it with something a bit like if this time of year, airborne allergies are a challenge, and dust, pollen is everywhere. However, only some people react to that kind of process, and they may be more reactive or less reactive or not reactive at all. So we all have plaque, we all have bacteria in our mouth, and some of us are more hypersensitive to it. And those individuals are very difficult to treat. Those who are severely sensitive to it, we call those severe periodontal disease. You definitely need a periodontist to be able to help you treat something like that, because that is a bit beyond what your general dentist can typically manage, which is simply cleaning your teeth every 6 months and coaching you, as well as also giving you some maybe potentially oral antibiotics to help also fight the inflammation. The periodontists are ones who can treat you further. With the additional 3 years, there's also surgical training that allows you to be able to treat it surgically if we have to. As well as once you get to the periodontist, not everything is just simply you have to cut to be able to get to something here. A lot of times they use other kinds of techniques such as lasers to be able to help regenerate the actual seal around all of your teeth, that your gums create this barrier over your jawbone, which of course we have saliva and bacteria there. We don't want all of that coming in touch with your bone that's supporting your teeth. So essentially your gum tissue drapes over top of that, and your teeth just kind of poke up through and around it. So let me just back up for a second, because if we're talking about that means we have gum tissue in our mouth that our teeth are protruding through. And we have two types of gum tissue in our mouth. We have the kind of loose kind that lines our cheek, that's elastic, and we can kind of pull on like around the collar, around your cuff, around your shirt. And then there's the tough kind that's right around the neck of your teeth, which essentially is the barrier that creates the seal around the neck of the tooth that protects the bone from the gum tissue that has, from the saliva that has the bacteria. And to that point about when you have bone loss, that seal that I was just mentioning to you often begins to break down or leak, and so that the bacteria can get through that barrier and affect the bone directly. And so, how do you maybe help the periodontal disease so that doesn't happen? Well, they can augment gum tissue called a gum graft. We talked about a little bit about this one of the other Ben and Gary shows. We talked about the chow technique or the pinhole technique, and that's a way to be able to regenerate a better seal and create a more robust gum tissue around the neck of the tooth, so that you help to protect that barrier between your bone and the inside of your mouth and that saliva where all the bacteria is. And so it's really important, I think, to understand the difference. And when you have a problem such as periodontal disease, and your general dentist decides that this is beyond what they can do with their general cleanings, then that's definitely need to be able to see the periodontist to be able to help to diagnose what the problem is, to be able to prevent it from progressing, and then to treat it so that you stop it in its tracks. And there are many ways that they can help you out, like I mentioned, such as gum grafts. There are laser treatments to be able to improve that seal around the teeth and around that areas, and to reduce the level of inflammation. And a lot of times that whole concept can be a little bit outside of the realm of what the general dentist training actually is in that 4 years. That's why the additional training is necessary to be able to focus in on that area so that it's done properly. And then when you unfortunately, if you allow the periodontal disease to progress to a certain place, I mentioned to you before, tooth loss. And we hate when that happens. However, it's a wonderful time in the world of dentistry where there are dental implants to be able to replace missing teeth. And that's where the periodontist can also assist us, because with their surgical training, they're able to place the implants and to do it in such a way that it sets us up for somebody like me as the prosthodontist, the restorative dentist, to be able to make it look like there's really a tooth emerging or growing or popping through the gum tissue, much like your natural teeth once did. So with a team like a prosthodontist and a periodontist, we're able to restore your mouth, not only with just making it look good, but also to optimal health, so that the ultimate goal, keep your teeth for the rest of your life. Implants are something that can last you a lifetime. Your teeth can last you a lifetime. They both can have complications. And we're here to be the ones that actually treat you. And with the combination of a periodontist and a prosthodontist, restorative dentist, you too can actually have that if you're in one of those categories. And hopefully that you're not there, and that you're in a place where we're preventing it here. But if you're probably searching this kind of topic, you're probably looking for one or in need of one. A periodontist is a vital partner in our process to be able to help you save your teeth, keep your teeth, or restore your teeth if you're missing them. I hope that answers a few questions about what a periodontist is. We're the Ben and Gary Show. Sans Gary. Gary, take care, man. Come back safely. We'll see you next time.